Yes, so just before I sit down and then take you through the today's topic, I'm going to, show you a little bit around. Okay, so let's go on and then do this together. As you know, it's always an opportunity for us to, learn or you know share some knowledge, some ideas together, and today won't be left out. Yes. So I have a very simple thing that people have been asking me about, and I've decided to, you know, share with all of us. I saw one pregnant woman out there with a very beautiful, costume, swim fit, yeah, with the belly like that and all that, with the husband with hair. So I was listening to conversations and stuff like that, content creator, what do? You listen. You listen, you don't judge. You listen, you don't judge. Yeah. So what came up was, so would this woman be able to actually have sex with the husband whilst pregnant? And this conversation, this topic actually has been coming up from friends, family, other people a lot of times. So on seeing this woman, I thought it wise to share some little bit of information about it. And if maybe later people have questions, you can just drop them down in the comment section and then we talk about it. So, what do I mean by can a pregnant woman have sex whilst pregnant or with the husband whilst pregnant? So, first of all, take just a second, subscribe to my channel, like the video, share, and if possible, comment if you have any questions at all, and then we will move on from there. During pregnancy, it's very difficult for some people, especially men, to fathom the fact that they can be able to actually do this, have sex with their wives when they are pregnant. And so some women also tend to have difficulty understanding the fact that you can actually do this or you cannot do this during the pregnancy period. My name is Dr. Samuel Ologo. I'm a board certified doctor from Ghana, and I'm proud to share a little bit of insight into this. During pregnancy, some women, unless there is a complication that you need much rest, you need no vigorous activity, there is threatened abortion, there is some form of placenta previa, that the placenta. So in my on my channel, sorry, on my channel, we don't actually bring out a lot of the medical terms, all right? But in pregnancy, a lot of people understand some of these terms. So when I say placenta previa, it means there is detachment of the placenta from the walls, the myometrium, okay? And then it has detached. The placenta is actually what is feeding the baby with all the nutrients, the blood that it requires. Now, when the placenta detaches from the wall, it means it's going to slope down and then get into the introitus or the vaginal, into the canal where the cervix, all right, where in case you are having sex and then it keeps on hitting on the cervix, the placenta that has been detached will end up, you know, is going to cause that vigorous activity is going to cause some form of, troubles where there's going to be bleeding and etc. And similar to certain types of abortions. All right. Now, with this in mind, with this in mind, I'm just trying to tell you that you can have sex because there is a release of prostaglandins during this activity. Now, the male's sperm, when it comes out, also contains some form of, you know, prostaglandins, which is going to activate the oxytocin of the woman. So during contractions, that is why sometimes the doctors will tell you when you are about 10, you can actually engage in this activity just to help the forceful contraction to be, strengthened. All right, and this contraction is what actually leads to the descent of the fetal head, that is the baby. Okay, it's going to um, cause the placenta, the covering of the baby to rupture. And when this ruptures, it means baby needs to descend now. All right. So during pregnancy, it is actually good to have sex unless there is a particular form of, you know, there's a particular form of complication, such as I mentioned earlier. And these complications must be seen by a healthcare provider to actually tell and then let you know whether you need complete bed rest or you can actually go ahead and um, have this activity. So, in general, in short, I intend to make this really quick so I can go and have some fun. Yes, so in general, you can have it if there are no complications such as abortion, such as placenta previa, abruptio, and etc. All right, then you can go for further to have your sex because under normal circumstance, the prostaglandin release is what is going to cause the contraction to be strengthened. Thereby, oxytocin will be released, and when oxytocin is released, fetal head will descend and then baby comes out smoothly. And so if you want to do it, please go ahead, especially in the first trimester, second trimester, unless abortion usually occurs in the first and second trimester. So if you are within that stage, then there is a risk of abortion, or there is a particular type of abortion that you cannot have sex, then you stay away. Your doctor will tell you. But if you can, please do it as much as you can because it's also good. It increases the bonding between the family. It increases the love. It increases a lot of things. One day I'm going to talk to you about sex and its importance, and you will understand. So please, if you can, go ahead. If you cannot, please hold on. And usually it doesn't go out throughout the pregnancy. Sometimes it gets to a stage you can actually then continue, especially the third trimester. You can actually do it because most often, the the cervix is closed. Okay, the cervix is closed. There is no way it's going to open without any contractions, without any forceful expulsion. So please go ahead. Between sex and pregnancy, you can still have the kind of fun you want to have. Cheers, and it's always a robust lifestyle with Dr. Samuel Ologo. Kindly subscribe to the channel, like, comment, and share to others. Let them also benefit. Thank you.